The next technique we're going to look at is a technique called Tapotement or Percussion. Now, you'd only use this for two reasons. Firstly, it would form a constituent part of a pre-event massage. And the second reason would be where you've had a patient who is in a really relaxed state, and when they get off the couch, their blood pressure might drop a fair bit. So it's to elevate their blood pressure before you finish a treatment. So the objective is to hopefully to induce a hyperemic response, so cause some redness in the tissues, induce blood flow into the target tissue. So before your patient or your participant takes part in their race or their game, it's going to get blood flow to the desired tissues. It's also going to pep them up because you'll be really quick, you'll be percussive, it should get them invigorated. And the final reason would be, hopefully it will have an impact upon the patient's muscle tone. There are three different types of Tapotement we're going to look at. The first one will be a hacking technique. Now, in reality, with the patients that you use this on, you're probably going to pick one of these techniques and it will form part of that pre-event massage routine. So the first one is going to be a hacking technique, where our contact with the patient will be on our ulnar border, on our base of fifth net here. So it's going to be in a nice wide stance, so you're in a strong position, and then you're looking for ulnar and radial deviation of your wrists, and it's going to be a light contact, but it should be really quite quick. So in terms of position, it's going to be here, and you can move up through the tissues and then drop down towards a deeper stance. That's going to be a Tapotement technique on your patient's quads. The second form of Tapotement will be what we call a cupping technique, where we're trying to really create a vacuum, draw blood flow up towards superficial tissues by causing that sort of cupping response in through here. So same posture, same position. We're not looking to be slapping our patient, but it's going to be using a cupping technique with your hands to cause the response that we just talked through. So in terms of position, it's going to be flexibility, so flexion and extension of your wrists, and that's going to be a cupping technique. And the final one is called a pounding technique, where it's a lightly clenched fist, same as hacking, but our point of contact will be the head of our fifth net on top here. So same position, looking for ulnar and radial deviation, lightly clenched fists, and that's going to be a pounding technique onto our patient's quads. So you'll pick and choose the one you're more confident with and the one that you think is going to have the most therapeutic effect upon your patient. But it's important to remember you'd only use those Tapotement techniques for a pre-event massage or when your patient's had a long treatment and you're going to increase blood pressure.